Next to present is Kimberly Campos. She currently attends Flushing High School. She joined the program this year, and she will be speaking about achondroplasia.
As she said, my name is Kimberly Campos. I worked at the bioinformatics department this year with Dr. Brennan and Professor McMahon, and today I will be talking about achondroplasia. This is the outline for my project. What is achondroplasia? It is a genetic condition that results in the shortness of arms, legs, fingers, and the height of a person. The average adult with the disease usually is about 52 inches tall. How does a person inherit it? Achondroplasia is a dominant gene, which means one change in the gene sequence can cause the disease. So this mutation is in the FGFR3 gene in chromosome 4. FGFR3 stands for fibroblast growth factor receptor 3. And this is important because it interacts with other growth factors, and when it is mutated, glycine is replaced with arginine, and this causes the receptor to become overactive. How prevalent is achondroplasia? It is the most common short-limb disease, and it affects 1 in 40,000 births worldwide, but it does not affect any specific gender or race. The chances of passing the disease. If a parent has achondroplasia and they want to have a child with a person that does not have achondroplasia, then they will have a 50% chance of having a child with the disease. If they both have achondroplasia, then they have a 75% chance of having the child with the disease and a 25% chance of having a normal human with a normal height. How can it be diagnosed? Doctors can use any imaging techniques like X-rays or ultrasounds, and with this they allow the doctors to see the structure, the physical features of a child. Like in the picture, there's an X-ray of a baby with achondroplasia, and they usually look at the legs because those that do have the disease, they cannot develop long bones. Physical symptoms and limitations. Some physical symptoms that they have to go through are breathing problems. They have short arms, legs, and fingers. They go through obesity. They have ear infections, and can develop a curve on the lower back. Dental problems, abnormal hand appearances, like their middle finger and their ring finger is more separate than the others, and they have a large head. And some limitations are that they are isolated from society and are unable to go to public places because it's only designed for those with normal height, so they are unable to go to public restrooms or playgrounds. Everyday life and quality of life. Since there is no cure for achondroplasia, most people adjust their whole household to their needs, and their quality of life is that sometimes they do get bullied at school if they go to school, and that leads them to not socializing. And as you can see in the picture, there is a teenage girl. She's 14 years old. Her name is Jayoti Amgi. She's from India, and she just goes to school every day, has a normal life, but she has to have special things made for her, like her desk, to go to school. Life expectancy and treatment. Those with achondroplasia usually live 10 years less than the general population if they do not have any severe medical complications. And some treatment could possibly be growth hormone therapy, or they could just ask their doctor to treat or prevent any other symptoms that are caused by the disease. Is there a cure? There is no cure for achondroplasia, but those that do have the disease should visit their doctor regularly to check up on any medical stuff. Some organizations provide support and information to the families that have the disease, like Little People of America and Dwarf Athletic Association of America. And Dwarf Athletic Association of America actually has athletic competition for those with the disease, because they usually cannot play original sports in the streets or anything. They have to have a safer way to play, and they provide that for them. These are my references. I want to acknowledge Dr. Satt, Professor McMahon, Dr. Brennan, Harlem Children's Society staff, and my friends back at the lab.